Hello, I'm Wolf Blitzer in Washington. We're here today to talk about a very important topic, celiac disease. It's an autoimmune condition that affects the small intestines. The only treatment is a gluten-free diet, which means avoiding wheat, barley, and rye. Research suggests that about 18 million Americans could be affected by a gluten-related disorder. Joining us today to talk about this, three guests. Dr. John Snyder of the Celiac Disease Program at Children's National Medical Center here in Washington. Vanessa Weisbrod, the executive editor of Delight Gluten-Free magazine. And Sarah Marx, a member of our own CNN team who lives with celiac disease. Guys, thanks very much for coming in. Thanks very much for the work all of you are doing to deal with this issue. Dr. Snyder, first of all to you, what is celiac disease?
It's an autoimmune disease.
Well, what does that mean exactly?
It means that, well, a little bit more than what you said too. There's a predisposition from the genes of certain people to get this disease. And in those people, their immune system doesn't function normally when it gets a trigger. And that trigger is a protein that's found in those 3 grains that you mentioned. When that trigger happens, it causes inflammation or irritation in the bowel.
And so what does that lead to?
And that can lead to a whole series of problems, a lot of symptoms, the common ones being things like abdominal pain or diarrhea or poor growth, but other things too, like headaches and skin diseases, and it can affect really any part of the body.
So the key is to make sure you have a proper diagnosis so you can deal with celiac disease.
That's absolutely true.
And to educate people out there so they know that this potentially is the source of problems that maybe even doctors don't recognize.
Yes, and that's been one of the problems. Because it can affect any part of the body, it often isn't thought of when people have difficulties, and so it can be missed for a long time for
and
people.
The pain, Vanessa, as you well know, because you suffered for a long time. You were diagnosed when you were 20?
I was 20 years old, but I had symptoms from the time I was an infant. I had seizures all the time, chronic headaches as a child. Everyone thought I was making it up because I didn't want to go to school. But all through my childhood, through high school and college, I went to my sorority formal with an IV in my arm of steroids because there was nothing else that would cure it.
And your parents took you to doctors and you were
after
examined
doctors.
all those years and no one had a clue what was going on?
No one had any idea what was causing it. And when I finally got a diagnosis, within 6 weeks, I was a healthy, normal college kid.
How did that happen? Who diagnosed you when you were 20 years old, right?
Yeah, so I was a journalism major in college, and I had a wonderful internship with Cox Newspapers, and I wrote an article about a conference at the NIH about celiac disease, and someone said that migraine headaches were linked to celiac. So I wrote the article, took it to my doctor, and said, test me. And that's how I found out.
And there is a test, Dr. Snyder, there is a test that can determine once and for all whether someone suffers from celiac disease?
Yes, it's actually improved a lot, the testing, over the past 10 years, and that's part of the reason we're finding more now than we did before. So there's a blood test, a simple blood test.
So you just take some blood and they send it to a lab and they can determine whether or not you have it?
They'll give you a very high likelihood of whether you have it. To confirm, though, we actually have to look inside by endoscopy and get biopsies to confirm the diagnosis. But the screening test is a simple blood test.
And once you get that screening test, you take the next step and then you can deal with it. Sarah, you had a similar problem as Vanessa did.
Yes.
You were undiagnosed for a long time, right?
Correct, yeah. I was 17 when I found out that gluten was behind my problems. I'd had stomach issues my whole life, and when I was young, my doctors thought it was lactose intolerance, but by the time I got to high school, I had a whole other host of issues. I would have really bad hiccups after almost every meal. I had patches of eczema all over my face, and this just extreme fatigue I couldn't seem to shake. And once I stopped eating gluten, those symptoms were all resolved, and my energy spiked, and my friends said, you're a different person.
So it's almost like a miracle.
Yeah, it's good. My quality of life has improved so much since I stopped
And you
eating
got the
gluten.
energy and you don't have any of those symptoms. Same with you, Vanessa,
Yeah.
right? Dr. Snyder, do you have this disease too, Dr. Snyder?
No, I don't have celiac disease, but I have such empathy for our patients. I've actually been on the gluten-free diet to show them that other people should.
So you just do it out of solidarity with them, even though you don't necessarily have to do it. And just sounds like a stupid question. If you don't have this disease and you're on a gluten-free diet, any negative side effects?
No, it's a very healthy diet. The only difficult thing is people have to be very careful about looking to see if gluten is in foods.
Is it just in foods, Vanessa? Because you've studied this extensively.
So the most obvious place to find gluten is in food. Cakes, pasta, pizza, that kind of thing. But it also hides in our medications, in nutritional supplements, and even in makeup. So if you do have celiac disease or a sensitivity to gluten, you have to think about everything that touches
What do you mean?
your
So
mouth.
when you buy makeup, you have to make sure that there's no gluten in that makeup?
Absolutely.
And does it say on the makeup kits?
There are a few companies that are now actually getting their products to be certified as gluten-free. So if I'm buying a lipstick, for example, I will only buy it from one of those companies because I'm a girl and I wear lipstick and I might lick my lips and don't want to accidentally ingest gluten from my lipstick.
And Vanessa, you brought some products, so show
I
us some of
did.
these products.
So these are actually all products that we give to every single newly diagnosed patient at Children's National Medical Center.
No matter their age?
Doesn't matter what their age is, although the beer does go just to the parents.
Is that alcoholic beer or non-alcoholic beer?
It is alcoholic beer.
So you can drink alcoholic beer as long as it doesn't have gluten.
Right, it has to be a gluten-free variety, and there are several companies now that are producing gluten-free beers. But so we have a great variety of products. We have sugar cookies, scones, cookies, even Bisquick has a new gluten-free mix, nut bars, pizza crusts, beers, and just there's so many options now.
That's some makeup over there? What is that?
Yeah, these are some makeups that are certified gluten-free from Red Apple Lipstick.
And, among other things.
Yeah.
Are you sensitive to the makeup too? So you want to make sure.
Yes,
So
absolutely.
you know about that as well.
Yep, I've got this this lipstick down here. I actually just put some on earlier, and yeah, it's a good thing to be conscious of. But even normal grocery stores, you don't have to go to a specialty store to buy your food. A lot of the grocery stores now carry these products.
Are they more expensive though than the regular products?
They do tend to be slightly more expensive, yeah.
Are they? But these companies that make this, they're not gouging folks out there. They're not taking too much advantage, right?
The bottom line is that the raw ingredients that goes into them are more expensive, so there is a price difference from the regular products. But there are online sites that sell them in bulk and at lower prices. Places like glutenfreely.com or Amazon even has great specials for finding products.
All right, so let's review, Dr. Snyder, some of the symptoms, because people, they may have some stomach issues or whatever, but they're not sure that they should be tested for celiac disease. When would you recommend a test based on what symptoms?
Well, what I tell families and also healthcare professionals in the community, if they have a patient who has symptoms and there's not a clear answer, and they've been looking and but just haven't found an answer, they really should think of celiac disease because it can really cause almost anything. But the classic symptoms are things like abdominal pain and diarrhea and poor growth. Those would be the classic kind of symptoms.
Because, as you say, 10 years ago, even doctors were not very familiar with this disease. It's relatively recent that there has been this education of what's going on.
That's right. There's probably three reasons that we're seeing an increase in the amount of celiac disease. One is we have better testing than we did before. The second is that there's increasing awareness, and as having a program like this hopefully is going to add to that. And then the third part is that it probably actually is increasing in frequency. We're not sure exactly the reasons for that, but it's probably dietary, and it could be related to the amount of processed foods that people are eating these days.
Other than making sure you don't eat gluten, are there any options available out there for people who suffer from celiac disease?
Well, that's really the treatment of choice, and that's the absolute treatment. But there are going to be other options as time goes by. There's a lot of research being done, and there's some products that are being looked at now that can help people that have celiac disease. But the take-home lesson in this is that you have to be on a gluten-free diet, and you have to follow it very closely.
And there's a spectrum of the disease from very, very severe to not so severe, right?
That's true. There are people that don't really have symptoms at all, but they get tested because they have a family member who has it, and there's an increased risk within families because of that.
But
link
if you
to
have
the
no
genetics.
symptoms, why bother being tested if you're not suffering from some stomach disorder or whatever, headaches?
Sure. Well, that's an excellent question, and families ask that all the time. And the reason that we recommend testing and treating with a gluten-free diet is if there is inflammation. If people have celiac disease, they have inflammation in their intestine, that can cause problems now, but even in the asymptomatic people, it can cause problems down the road, some very important health problems that can affect them later in life.
Are all people affected? Is this a hereditary disease, in other words?
Yes.
And is it just in the West? Is it all over the world? Are certain ethnic groups more prone to this than others?
In the old days, like 10 years ago, we used to think it was seen in Europe primarily, and in parts of the world like the United States. But what we found now is that it's found everywhere in the world. There is a predisposition, though. People have to have the genes, but those genes are found throughout the world.
What advice do you have for young people, Sarah, who may be watching us right now, who may have a little stomach disorder, queasiness, they may be getting headaches, and they don't know what to do? What's your advice?
I would recommend to get tested. It doesn't hurt. It really doesn't hurt to get tested. And if you do have celiac disease, don't be scared. Don't Don't be afraid. It's really not a difficult life adjustment to make, and you feel so much better after you make the adjustment, if that is the problem that you're dealing with.
And Vanessa, how can people spread awareness of this disease?
So the first step is that they should visit the childrensnational.org website. On the celiac program site, there's over 300 symptoms that are listed. So it really points out the different systems of the body that it can affect and what people might want to look for. If you or a family member, a loved one, a colleague has those symptoms, they should suggest getting tested. The other thing that I like to say is don't be afraid to speak up. If you're in an elevator, just like riding up here to the studios today, tell somebody about celiac disease. Mention it, suggest that they learn about it, because one comment could save a life.
Tell us about the program at Children's Hospital.
We have a program that features 5 major activities, and one I'd like to tell you about especially today is our activity that looks at the psychological parts of celiac disease. We've just hired a psychologist, and we're the first program in the country that has that as an integral part of our program to take care of the whole patient. And as you might appreciate, for children who have a disease that makes them different from other children, and it's a chronic illness, there can be a lot of psychological issues. So now we have a psychologist who's part of our team.
And this is now the general medical accepted formula. There's no real controversy over celiac disease among the physicians, is there?
No, I would say that it's accepted as a clear diagnosis. It's very straightforward, and either people have it or they don't have it.
Well, you guys are doing important work. Thanks so much for helping to educate everyone who's going to be watching this little video of ours. I'm grateful to all of you for doing it, and I know there's a lot of people who are watching who are going to be especially grateful. They may not even know they have this problem, but you know what? They'll know soon enough, and they'll treat it, they'll deal with it, and their lives will be improved. Guys, thanks very, very much. To learn more about celiac disease and the gluten-free diet, please visit, once again, childrensnational.org/celiac. You can get a lot more information over there. For now, thanks very much for watching. I'm Wolf Blitzer in Washington. Bye-bye.